Number two, Sachin, Christopher, medicine, convulsive seizure. Yes, Sachin, Christopher, nursing. You can start now.
Good morning, Martha. I'm Christopher, one of the registered nurse working in this hospital, and I'll be taking care of your kid. And how's your kid now?
Yeah, she's fine, I suppose. But I'm little
Okay.
bit worried. I want
Uh,
to know about this problem. One second.
uh, yeah.
Yeah, I want to know about this problem, more about this
May I know
problem.
what is the problem,
Yeah,
Martha?
I want to know this about this epilepsy. What is this
Yeah,
epilepsy in the first place, and what are the causes of epilepsy?
yeah. Uh, Absolutely. I'll explain in this regarding this in detail. Are you free right now?
Yeah, of course, nurse.
Yeah. And epilepsy is an abnormal activity of brain, abnormal electrical activity of brain. So that will be causing seizures. And the recurrent episodes of seizures is called epilepsy. Uh, could you understand this?
Yes, of course, nurse.
And causes might be idiopathic, which means unknown, but mostly because of in children, it might be because of fever and other some reasons. And may I know in family anyone is having this history of seizures?
I don't have any memory of these things because, yeah, I don't. I
Hmm.
never noticed this. So, can you please explain me further?
Because I'm asking about the family history because even the because of the family members also the kid might be getting this
No,
epilepsy. So
nurse.
I have
Nobody in
asked
my
regarding
family
that,
has this
and
problem.
so the cause might be idiopathic, and we need to rule out regarding this. And recently, neurologists had advised some investigations. We have done that, and the reports are yet to come. So regarding that, the neurologist will be talking to you. Is that okay?
That's absolutely fine, nurse. Tell me more. I'm concerned
And
about my daughter. Will she have other convulsive seizures in the future? Are there chances?
uh, maybe because there are increased chances of recurrent seizures, so you should be careful about that. And if your kid is getting seizures at home, uh, first of all, you need to know the symptoms of seizures, right? Do you know
Yes,
the
nurse.
symptoms of seizures?
No, nurse. Can you please explain me more about this?
Yes, absolutely. And if your kid is having any jerky movements of the muscle, like tonic and clonic, we call tonic and clonic, the jerking movements of the body, hands and legs especially, and sometimes the seizure might be unnoticed. So they'll be having tiredness and uh, incontinence after the seizures. So
Okay, nurse.
it would be causing these are the some symptoms, and also the tongue bite and being unconscious for few moments. These are the things you need to be cautious about. And if your kid is getting seizures at home, there are some special precautions to take care of. Uh, and are we on the same point, Mata?
Yes, of course, nurse.
Mm. Okay, that's good.
I want to
And
know if in these situations of other convulsive seizures,
mm,
I want to know what I should do and what I should not do.
yes, sure. As uh, a parent, it's your responsibility to do uh, to make sure your kid is lying in the left lateral position, specifically to prevent tongue fallback. And if your kid is getting any secretions, it would prevent furthermore aspiration into the lungs. So, preferably, the left lateral position is good. And you should never give an key or sharp objects to your kid, metallic objects to your kid. It would cause any harm to the kid. So, it's better to keep your kid in safe environment and remove sharp objects and falling objects near the patient. Is that okay?
Yeah, that's fine, nurse. And
And make uh, yes,
y- y-
yes, Mata.
yeah, I want to know
Mm.
what I should do if my daughter appears disoriented or begins
Mm.
behaving strangely.
Uh, if your daughter is being disoriented or unconscious for a while, make sure she is breathing. Check for her breathing, and no object should be placed near her mouth. And as soon as possible, call 911 or ambulance to get an help. You- Do you understand, Mata?
Yeah, of course, nurse. And
And
okay, you asked me to call an ambulance if this is the condition. Are there any other
mm,
conditions when I should call the ambulance? Any other conditions?
yes, there are some other conditions which I was about to say. The conditions are like recurrent seizures, more than two episodes of seizures, and the seizure activity lasting more than 5 minutes or near to the 5 minute point. These are very dangerous to your daughter, which would cause hypoxemic brain injury, uh, which is a serious condition. So, if your kid is getting even a one episode of seizures, make sure you're going to hospital. Is that okay?
Yes, of course, nurse. Thank you very much. And what
And
other support might be available for my daughter?
I would like to refer you to an epilepsy foundation which we are having in our hospital, and they'll be taking care of your concerns which you have asked me, and they'll be explaining you in detail, and they'll be providing you some helpline supports and more information about the epilepsy and local telephonic contacts. Could
Okay,
you
thank you.
understand?
Yeah, thank you very much,
And
nurse.
also you could refer some internet, specifically the NHS site and also Mayo Clinic. These are the trusted websites, so you can get some more knowledge about this epilepsy. And do you have any other concern, Martha?
Yeah, no, nurse, that's quite clear, quite obvious. Thank you very much for your valuable support. Thank you
Mm,
very much.
thank you, Martha. Have a speedy recovery.
Okay, okay,
Mm.
nurse. Thank you very much. Right. Yeah, let me give you some points. Let me give you some points. Right. First thing is Sachin Christopher, nurse.
Yes.
Yeah, you said, yeah, let me give you the feedback. Yeah, first thing is, yeah, first thing is, one of the registered nurses, not one of the registered nurse, it is one of the registered nurses. Then next one, you said furthermore, aspiration. No, as further aspiration, it will control further aspiration, or aspiration furthermore, something like that. So furthermore aspiration is wrong. Further aspiration or aspiration furthermore. So like that. Then next one, you used many times kid, kid, kid. That's not very fine. Don't use that word kid multiple times. Kid, and repeatedly you have used the word kid, right? So
Yes, sir.
you have to avoid that one. That's not highly recommended. And kid, kid is it's not um, uh, a formal word, you can say, not formal word, informal word. So avoid informal words as far as possible. Let them be official. Is that clear? Let them be
Okay, sir.
official. Is that clear? Fine, fine.
Yes, sir.
Okay, fine. So that's it. You are doing very well. That's really fine. Wonderful. You have done a good job. Okay. Right.
Okay,
So,
thank you, sir.
right. Do you have anything to ask?
That's it, sir. Sir, next, what session we are having, sir?
So we'll have a session for reading also today. We'll have a full session, part A, part B, part C. In the meantime,
Mm,
if the session is not going now, speaking sessions are going on. So what you can do is you can do one reading, you can do one listening, and you can do one writing in the meantime. Okay.
okay, sir. Sir,
Okay.
regarding grammar, sir,
Yeah, grammar we are taking the class today. We'll take the
today.
class
Okay,
today
sir.
afternoon maybe. Hmm?
Afternoon. Okay, sir.
Sure, sure, sure.
Thank you, sir.
Right, dear. So Amar Babu, you also can do one reading, one listening, and one writing. Okay. And I'm waiting for the other regular students.